the evidence that led to kind of the filing of the NDA and the FDA's decision to accept that NDA and hopefully will lead to a potential approval for Rusfertide really comes from a couple of studies, right? So we have the phase 2 study, which is the Revive, and that's actually in a long-term extension study, which we're continuing to follow those patients long-term in the ongoing Thrive study. And then we have the phase 3 Verify study. And really the idea was quite simple. Let's look at this agent that's a hepcidin mimetic that we think can better control hematocrit. We know controlling of hematocrit is something that's a mainstay of therapy for patients with polycythemia vera. And in the phase 2 study from Revive, we enrolled patients that were requiring phlebotomies as part of their therapy for polycythemia vera, whether or not they were on cytoreductive therapy or not. That was continued. So this was just an adjunct to whatever the current standard of care was. And we saw that the addition of Rusfertide drastically reduced the need for phlebotomies and led to kind of sustained durable control of hematocrit. So, we've continued to see that durable control play out in the ongoing Thrive study, which is the long-term follow-up of Revive. And this led into the Verify study, which is a phase 3 study, which then kind of looked to confirm those efficacy results from the phase 2 study. And in Verify, very similarly run, where enrolled patients that were requiring phlebotomy as part of their treatment plan for polycythemia vera, whether or not they were on cytoreductive therapy or not. All of the current standard of care was continued, and patients were randomized to receive either Rusfertide or placebo for the first 32 weeks. With a primary endpoint of lack of phlebotomy eligibility being assessed from weeks 20 to 32. And Rusfertide showed a drastically significant ability to reduce that need for phlebotomies and reduce phlebotomy eligibility compared to placebo. We also presented at ASH the kind of part 1B of the study where patients who were on placebo rolled over onto Rusfertide. And again, you saw those patients who had continued to need phlebotomies, reduce that need very quickly after rolling over onto the Rusfertide arm. And this is a study that continues in parts 2 and 3 with long-term follow-up because, again, while it's nice to show results at week 32, this is a disease that patients live with for a long time. And our goal is stable control of the disease, stable control of hematocrit, ability of patients to continue with their lives the way they'd want to. And so we do need to look at long-term outcomes to really confirm those findings can be something that we maintain.